I would like to start by expressing my appreciation for you, Stacy, for asking extraordinarily relevant questions, getting answers, driving this field forward. Thank you. You are doing great work. Maybe one more. As well as my appreciation for all of you here to learn, and I'm sure take this message and spread it, and to CannMed for organizing this and having me back today. So my name is Dustin Sulak. I'm an osteopathic general practitioner. I've been practicing cannabis medicine in Maine for the last 10 years, and it's been an incredible gift to myself and my patients. So, we've got the slides up here, but I don't see them down here. But maybe we'll just dig right in. So today I'm talking about cannabis and its role in integrative medicine, health promotion, and disease prevention. And so to begin with, well, here's an overview. Integrative medicine principles we'll just go through as a roadmap, and I think probably a lot of you aren't aware of these principles, which are a great solution to some of the biggest challenges we have in healthcare today, and demonstrate a really nice example of how cannabis is not just helping patients, but also helping change medicine. We'll also touch on psychoactive adverse effects and psychoactive benefits, natural acidic cannabinoids, their bioavailability, dosing, and if we have time, a bit of their utility, and how to use cannabis to prevent disease. So I want to start off with a little attention to a very big problem that we have here in this country. We are doing a terrible job taking care of people. Our healthcare system per capita spent we spent over $10,000 per person per year on healthcare. That's almost 18% of our gross domestic product, totaling $3.3 trillion spent in this country on healthcare. But despite spending more on healthcare than any other country, we fail miserably. We rank last or near last on dimensions of healthy lives, access to healthcare, efficiency, and healthcare equity. Actually, in 2013, the Institute of Medicine reported that we have worse health and premature death rates than any other country at every age group and every income level. We are clearly spending a lot of money and doing something wrong. So what's the solution to this problem? Well, there actually, let me start here. What are the contributing factors? There's many, but I believe that one is this over-reliance on monomolecular therapies. We know that we are complex systems with multiple redundant pathways and multiple nodes for each disease state. And the idea of using a single molecule to influence that system in a direction towards health, it works sometimes, but it doesn't work a lot of the times, and we really overuse that. We tend to manage chronic disease instead of prevent it. That's a mistake. The whole healthcare infrastructure and the economics of healthcare really promote a benefit to the system when people are sick and their disease is managed, not when it's cured or prevented. So the incentives are all backwards, and there's many other contributing factors. So there is a solution, and as you'll see many times in this presentation, I give a nod to one of my beloved mentors and friends, Andrew Weil, who I just respect him so deeply for profoundly changing the direction and trajectory of medicine, because I believe what he said 20 years ago, at some point integrative medicine will simply be called good medicine. I think we're starting to see that become true. So there are 8 principles that have been identified by a consortium of integrative medicine establishments, and I'm going to walk through them. The first is a partnership between patient and practitioner in the healing process. A partnership. This is something that's kind of new to medicine. It used to be this kind of top-down, I'm the doctor, I'm going to tell you what to do. That does not work with medical cannabis. Why? Because there's so many different forms, as Stacy pointed out, so many different types of cannabis, delivery methods, individual responses, the need for dose titration to find someone's optimal dose, an optimal regimen. There's a lot of back and forth between patient and practitioner. It's a real partnership in the healing process. This is essential and getting great results with medical cannabis. Patients become empowered to feel like they have the reins on their own health and they can make decisions. It improves their self-care because now they're making those decisions, they're administering the cannabis to themselves, they're taking notes, and at least in my practice, and building self-awareness, which leads to self-efficacy, a can-do attitude, a feeling like they can get better and they can participate in their healing. And then there's the therapeutic horticulture, which is an incredible aspect of cannabis that's often not mentioned. But when a patient can take a seed or a cutting and put it in their backyard and watch the plant grow and celebrate its growth and look at the beauty of this plant, and then harvest it and produce a medicine in their home that's cost effective, that they can use for the whole year and take care of themselves, that is incredible. That is empowerment. That's a solution. Thank you. And for everyone in here that's involved in the cannabis industry, if you have any influence in politics and lobbying, please, there's many states right now where it's still not legal for patients to grow and produce their own medicine. Whether it helps or hurts your bottom line, as a community, we all have to promote that availability. Thank you. This is a picture from my backyard. The second principle is the appropriate use of conventional and alternative methods to facilitate the body's innate healing response. This is something that medicine often overlooks. We're focused on the disease, not on the health. The founder of osteopathy said anyone can find the disease. The job of the physician is to find the health in the patient. So if we're talking about innate healing response, the question is, what can we do to support that innate healing response? And what can we do to remove obstructions from that innate healing response? Anyone have an idea of a system that might be a good target for doing just that? Right? The endocannabinoid system, involved in every disease and every symptom known to man, widely distributed throughout our body, as you can see here, CB1 and CB2 receptors, addressing the endocannabinoid system to help treat disease and promote health via enhancing our innate healing response makes perfect sense. And we've got a great tool to be able to target this system. It's in our backyards if that's possible, and it's available more and more now. We don't necessarily need fancy pharmaceutical drugs to target this system, even though there's a place for them. The third principle is the consideration of all factors that influence health, wellness, and disease, including mind, spirit, and community, in addition to body. I want to focus on mind, spirit, and community. So the psychoactive adverse effects versus benefits. What are the adverse effects? Impaired memory, confusion, anxiety, paranoia, discoordination, dizziness, being tired. These are things I see as side effects in my practice, typically related to excessive doses of THC, and also related to factors in set and setting. So what is someone's internal mindset? What are they expecting out of cannabis, and what are their goals and intentions? And then what's their external setting? That influences a person's response to cannabis. These are usually mild and self-limited. Some people will complain of residual effects the following day. But what are the psychoactive benefits of cannabis? Well, to begin with, this euphoria, which has been described as a side effect in many papers, in my opinion, this is a gift to patients that are suffering. If we can help them feel positive mood, relaxation, laughter, socializing, time distortion, which allows them to come into the present moment, and then the intensification of ordinary experiences, which can be leveraged for a practice of mindfulness called savoring. Savoring is a direct antidote to anhedonia, which is a major culprit in depression and especially opioid use disorder. When people are no longer able to experience pleasure from the natural things in their life that should give them pleasure, then they go seeking something that temporarily gives them a stronger pleasure signal, and that's a downward spiral into just having to use a drug or a substance to feel normal. Cannabis can absolutely break that cycle, especially THC, when used intentionally to support a process of savoring. People can restore the natural pleasure they get from these healthy activities in their lives, including eating, listening to music, having sex, just connecting, taking a walk, smelling the flowers. Now, there's also something I've seen over and over again in my patients, this unbundling of symptoms and suffering, where they first come in and it's just this ball of suffering and they feel like they need to escape. And after experiencing the psychoactive effects of THC-dominant cannabis or balanced THC CBD cannabis, they're able to tease this apart. And they realize there's this sensation that's more neutral. And in the past, they've felt like that sensation was a really bad thing, but now they're not judging it as much anymore, so they're not suffering as much from it anymore. Less anxiety about continuing to have that sensation that's now more neutral, and then less of the pain behavior associated with that, which impacts their whole family and their whole community. This unbundling is an essential gift of cannabis. And then this return to normality. For all the cannabis clinicians and caretakers and dispensary agents in the room, I wonder how many times you've heard someone say, "This plant has given me my life back." Can I see a show of hands? I thought it was like a planted phrase that patients were told to tell me because it just happened so many times again and again. I've gotten my life back. But this is really what people say. And this was described in a qualitative study that came out of Israel, and they called it restored self, a return to normality. They feel like they've lost their lives and cannabis gives them their lives back. And what's interesting is people report this even when their symptoms don't improve. Their pain, their anxiety, all their symptoms could be the same, but they still feel like cannabis has given them their life back. It's incredible. Oops, I went backwards. And then what are patients reporting? Increased self-awareness, a sense of connection to God and nature and the universe, viewing oneself from a different vantage point. These are all really profound things that no pharmaceutical medication will just give to someone. And it goes on, feeling of acceptance of their place in life, finding creative solutions to their problems, and this mental, emotional, and physical capacity to change, which is likely correlated with enhanced neuroplasticity. Now, people experience this during the acute effects of THC, but these gifts persist after the THC wears off. They take this with them the next day and the next week. This is a change in their relationship with themselves and with the world around them. This is profound. Hard to get this without the psychoactive effects of cannabis. And then there's community, the cannabis community, which we are all here together in this cannabis community. And I hope that all of you that are new to the community continue to have this experience of, wow, the cannabis community is really something special. People care. People are altruistic. They're willing to help, to lift each other up. There's a lot less greed, a lot less selfishness, and more giving. And this is the spirit of cannabis. And I hope that any of you have a chance to experience this and that all of you can become a part of that and contribute it. Because if you let cannabis in and let it teach you how to live, it teaches this community, which is really essential, not just for fixing our healthcare system, but for healing our world. And we're not going to get into all the big problems in the world, but community is essential. So principles number 4 and 5, a philosophy that neither rejects conventional medicine nor accepts alternative therapies uncritically, and the recognition that good medicine should be based in good science, be inquiry-driven, and be open to new paradigms. So of course we have some pretty good data, nicely summarized by the 2017 National Academies report, and there's conclusive evidence that cannabis is effective for chronic pain, chemotherapy-induced nausea and vomiting, multiple sclerosis spasticity, at least subjective symptoms, and moderate evidence that cannabis or cannabinoids associated with improvements in sleep disturbance. This is great. This comes out of big clinical trials. This is a start, but this is a very early start. We need a lot more. We need new paradigms of thought, including what Dr. Gruber has been doing. I think she's, you know how I feel about her work. I also want to mention that this doesn't all have to be limited to artisanal and herbal cannabis. The concepts that we're learning here in cannabis medicine using the herb can be applied to the pharmaceutical industry, to drug research and drug development, and there's a perfect template for that, something called network pharmacology, which is a newish approach to drug discovery, and it involves network analysis to determine a whole set of proteins critical in any disease, and then chemical biology to identify molecules capable of targeting that set of proteins. It's usually a multifactorial treatment that involves multiple compounds and multiple targets. This is one example of a Chinese medicine, Qi Shen Yi Qi, which treats heart attack and other heart disease. And you can see here all the different pathways, the different genes that are targeted, and the different molecules involved. This is the type of systems biology we need to take pharmaceutical drug development to the next level and stop looking for a single molecule and hope that's going to solve all our problems. It hasn't worked, and I don't think it's going to. Principle number 6 is the use of natural, effective, and less invasive interventions whenever possible. Has cannabis demonstrated any of this? Well, to begin with, when I was 19 years old, I read through this report from the Institute of Medicine. Right after it came out, I was involved in cannabis activism, and I was so happy to get this quote on my flyers when I was tabling. Except for the harms associated with smoking, the adverse effects of marijuana use are within the range tolerated for other medications. No fatal overdose, no organ damage, no permanent cognitive deficits in adult heavy users, and actually improved neurocognition in medical users. A very low risk for abuse, especially with medical preparations. This is harm reduction. This is less invasive and less dangerous than narcotics and opiates, anxiolytics, antidepressants, nonsteroidals, and so forth. Look at the drugs that people are using cannabis to substitute. This is much safer for the population, a great example of integrative medicine. Moving on to principle number 7, use of the broader concepts of promotion of health and prevention of illness, as well as the treatment of disease. Let's talk about promoting health and preventing illness. And we can look at some of the leading causes of death, and we'll just start with heart disease since that's high up there. But this conversation around cannabis applies to cancer, accidents, strokes, and perhaps lower respiratory disease as well. Now, here's an interesting study where 2 micrograms per kilogram of body weight of THC was administered by injection to mice 2 hours before giving them a heart attack. And this tiny, tiny dose of THC, which most of you would expect to do nothing, which I would expect to do nothing, ended up protecting the heart from the heart attack, improved fractional shortening, decreased the release of troponin, which is an enzyme that shows us the heart cells are in trouble, decrease the size of the dead cells in the heart, and decrease the inflammation and accumulation of neutrophils to the area. 2 micrograms per kilogram, I can't emphasize enough how tiny of a dose that is. And this dose has been shown in 2 other animal studies to have effects both on protecting the brain and protecting the liver. Many of you that know my work know I'm extraordinarily interested in the ultra-low dosing range of cannabinoids. There's something special happening there. So does this work out in humans? Do people walking around with tiny bits of THC in their system actually have better outcomes after a heart attack? Looks like the answer is yes, based on this observational data of over 1 million people, comparing those who self-reported using cannabis to those who didn't. And you can see that after having a heart attack, those who were cannabis self-reporters were less likely to die. They were less likely to have invasive interventions like intra-arterial balloon pump and percutaneous interventions, but they were more likely to be put on a ventilator, likely because they were cannabis smokers and had some impairment in their respiratory function. But do we know direction of causality here? No, we don't. There's an association between self-reported cannabis use and doing better after a heart attack, and I think that's a good lead. The preclinical data supports it. Now, what about preventing the steps that lead up to a heart attack, right? In my opinion, it's not just enough to protect someone when they have a heart attack. We actually want to prevent that from happening. So we need to look at atherosclerosis. It turns out that a fairly low dose of THC in rodents can prevent the development, or at least slow down the development of atherosclerosis. This is a CB2 dependent process, so THC could help with this. Beta-caryophyllene could help with this. This is, in general, an anti-inflammatory and tissue protective activity that's happening inside the blood vessels. Moving from heart disease to brain injury, some more human observational data, looking at people who come into the hospital with a traumatic brain injury and dividing them into those that have THC in their system and those that don't. And guess what? Those without THC, 11.5% of them died. Those with THC, only 2.4% died. What might be causing this? Well, we have a little bit of evidence. You heard Dr. Meshulam speaking about it yesterday, that the cannabinoids are neuroprotective agents. And I think that most of us in this room that really recognize this have kind of that plan that we've told our significant others about. Hey, if this ever happens to me, I want you to get some of these cannabinoids in my system ASAP, because it's likely that they're protective. Or we could just keep low levels in our systems anyways. There's another observational study looking at brain bleeds. And again, you can see that in the cannabis negative group, only 3% survived, 3% had no symptoms. 19% in the cannabis group survived that brain bleed with no symptoms. And you can see that whole cannabis group on the top is shifted over to the right. There is a neuroprotective effect that is showing up in human patients. What about obesity and diabetes? Are these a big deal? Is this worth talking about with disease prevention and health promotion? You can see what's happening on the map here. Look at what's happened to our country. We've become a country of obese and diabetic individuals. There's a big problem here. The medical cost of diabetes and obesity looking like over $300 billion, and that was several years ago. I'm sure it's probably $400 or $500 billion now. I want to help put that into perspective. In 2008, the UN estimated the cost for feeding every hungry person in the world, for eliminating hunger in the world, $30 billion per year. And if we would all get together as a global community and spend $30 billion a year for 10 years in a row, there would be a sustainable infrastructure to prevent starvation and hunger ongoing. What are we doing instead? We're overfeeding ourselves with a bunch of crap and then spending hundreds of billions of dollars on the sequelae. There's a problem there, but I also do like to put that into perspective compared to our U.S. annual defense budget. Now, what if our defense strategy was to eliminate poverty and to eliminate hunger? Do you think that would make us safer? I think that might help end war. Maybe that's the new mission someday. Now, cannabis use is associated with a lower incidence of obesity. You can see from two large data sets here, also associated with a lower incidence of diabetes. And then just in the last year, we've had a lot more data come out showing, this is from the Pittsburgh Youth Study, which followed people over more than 20 years and found that greater cannabis use was associated with improvements in all of these cardiometabolic risk factors. This beats the pants off of a statin drug. I mean, this is, again, no direction of causality. This is an association, but the data comes up again and again. Maybe it is just that cannabis users are more likely to go exercise and be runners and make healthier choices, and maybe it's a direct physiologic cause, or maybe it's some combination. Maybe the cannabis is actually helping people wake up and realize that they are beautiful and they are lovable and they're worth taking care of, and it makes sense to make the right choices to support a healthy and happy life. That's what I'm seeing. Now, is there a preclinical basis for a causal effect of cannabis preventing obesity? Absolutely. You can take mice and give them an obesogenic diet, but when it's given in the presence of THC, they do not become obese. They maintain their normal weight. That's something. I think that maybe we're this isn't a cure-all, but I think that cannabis is likely to help most people with their metabolic function and their metabolic physiology. When I started my practice as a cannabis clinician, I was very scared that my overweight patients were going to get more overweight, that they get the munchies, and this is one of the major potential side effects. And I have not seen that in a decade of practice. Most people's weight normalize. Those that are overweight lose weight, those that are underweight gain weight. Cannabis is this great homeostatic regulator, and it's doing that at this level as well. So how to use cannabis for health promotion and disease prevention? Well, this is a metaphor that I use with a lot of my patients, so I'll walk you through it. Cannabis can be a crutch and cannabis can be a tonic. So when someone breaks their leg, if they want to still move about, they do need to get the weight off of that fracture, because if they don't, it's not going to heal. So they use a crutch for a while. They are now able to walk around and let that leg heal. But if they never stop using the crutch, the leg will not finish its healing. That's because it's the force vectors going through the bone and the connective tissue that actually stimulate those final stages of knitting together and healing. So at some point they have to put down the crutch and start bearing weight. People have to do that with cannabis as well. Our sickest patients can use cannabis in a way that helps them manage and helps get through their life. But then as they start to heal, they tend to shift their cannabis use patterns and need less of it and use it in different ways. And eventually they're feeling so good, it's no longer a crutch. Cannabis becomes a tonic. So what's a tonic or an adaptogen? A tonic is a compound or a substance or perhaps a practice that improves our resilience to stress. We live in an incredibly toxic environment, chemically toxic, socially and psychologically toxic. There's so many challenges to being healthy nowadays that I think a lot of us recognize we need to rely on botanical medicines in order to support our health and to stay healthy. So what does it look like when cannabis is used as a tonic? Well, first of all, I recommend strongly using the lowest effective dose, because if you're building tolerance to THC, then you're likely building tolerance to your endocannabinoids, and you're undermining the efficacy of your primary homeostatic modulatory system, the endocannabinoid system. So don't build tolerance to THC, use the lowest effective dose, and many of you would be surprised how low that dose can be. Number two is use cannabis to promote restorative sleep. This is my primary goal in any of my patients that aren't sleeping well. THC works so well for sleep. Use cannabis to reduce stress. Use cannabis to enhance health-promoting activities. Cannabis is not to be used as a pharmaceutical medication. It can act that way, but it's even more powerful as an adjunct to other treatments, an adjunct to lifestyle change, especially. So cannabis with exercise, cannabis with meditation, and with the savoring practice I described earlier. Incorporate the psychoactive benefits into your life. So for a lot of my patients that come in and say, I don't want to get high, I never want to get high. Okay, that's fine. How are you sleeping? Terribly. We're going to start using a little THC right before bed. They come back 3 months later, they're sleeping beautifully. The next step is, okay, once or twice a week when you don't have much going on in the evening, take that THC dose from bedtime and bump it up to dinner time. And just let me know how you feel. And they come back, oh, that was so wonderful. I felt happy. I was relaxed. It wasn't like I thought it would be. I thought it was some like psychedelic hallucinatory thing. No, it just felt good. I liked it way better than 2 glasses of wine. That's what people come back and tell me. And then avoid or limit combustion. I think that avoiding combustion in my mind means avoiding so-called vape pens or combustion pens, and we don't need to say any more about that. But if you're having a toke once or twice a day or once or twice a week, I don't think that's really hurting your lungs very much. But the dry flower, the herbal vaporizers, are probably the best way to inhale cannabis if inhalation is a desired route. And then finally, I want to end up with raw cannabis, which I think from an ethnobotanical standpoint and based on my own experience in myself and in my patients, it's the raw cannabis that is the best form of cannabis as a tonic. If you want to use cannabis to stay healthy and to prevent disease, check this out. So this is some of the first pharmacokinetic data of oral absorption of THCA and CBDA in just 9 people with medication overuse headache. And they took like a type 2 variety of cannabis, had some THC, some CBD in it, made into a decoction, which is like a tea except it's covered and simmered for a bit in water, or an oil. And you can see these are the pharmacokinetic data showing the bioavailability. You might notice one peak that really stands out there in orange. On the left we have the decoction, and on the right we have the oil. That orange peak is THCA. THCA is being absorbed far more than THC. If you look at this one, CBDA, look at the bioavailability of CBDA compared to CBD. This is impressive. At the top of the slide slide here, you can see what the actual composition of the oil in the decoction look like. But I did the math for you. These are the areas under the curve. So in the decoction, THCA was absorbed 50 times better than THC. CBDA was absorbed 5 times better than CBD. In the oil, THCA was absorbed 32 times better than THC, and in the oil, CBDA was absorbed 11 times better than CBD. High bioavailability. So how do we do this? How do we use cannabis to promote health and prevent disease? Well, these pictures aren't actually that accurate, so stop taking pictures of them. I'm gonna tell you how to do it. You take a little bud. Hopefully it's a type 2 variety that has some CBDA and THCA in it. You put it in your mug and you pour the hot water on top of it, or the hot coffee, or whatever tea, however you like your hot beverage in the morning. Include a little nugget in there. And then when you're done drinking it, if you're willing, take that thing and eat it. That's it. By little bud, I mean something about the size of a pea. You really don't need much. It can be tiny. And what my patients tell me is when they start doing this, they don't notice much until about 2 weeks. And then their arthritis starts feeling better. Their resilience to stress starts improving. This is not as fast acting as the decarboxylated cannabinoids, but extraordinarily powerful. And I encourage you to try it. Try incorporating it. We don't need maybe there's a place for stabilized acidic cannabinoids, but trust me, if you've got some of these buds in your cabinet or in your fridge, you can absolutely take those and start using them right now without a lot of, without waiting for a pharmaceutical product. It's right there at home, the acidic cannabinoids. And then finally, I'd like to end up with principle number 8. Training of practitioners to be models of health and healing, committed to the process of self-exploration and self-development. I hope that as a cannabis expert, a physician, an educator, and a steward of this plant, that I am walking my talk and living this principle. Thank you.